Most communities on Oahu are pretty family-oriented. Growing up on the North Shore, it's a big part of our community. And I'm very proud that I'm a paramedic and I can take care of the community that helped raise me. Before the pandemic started, there was no mask wearing. It was a lot of just get out of the ambulance, wear your gloves, put your stethoscope on, and go to the call. Now it's a whole process, which we've gotten much better at. So for us, we'll respond to a call, and our dispatchers are good at giving us info before we get to the call, like, this may be a COVID-19 patient, so wear your proper PPEs. The most critical patient that I picked up that was COVID-19 positive was, we get there and the patient needs help breathing at this point. So for me personally, I know my training just kicks in. When you see somebody not breathing or needing assistance breathing, your first reaction is to just go in and help them. Then you think, oh, I wonder if this is COVID-19, right? Maybe I should take a step back and think about this a little differently. And then the next couple of days I'm off of work and there's this, discussion in my own head of, do I want to take that risk and see my family and possibly infect them? Am I going to infect my coworkers, my other patients? So that's always in the back of our mind. But it's a risk that I think everybody in our department understands when they sign up for this job is we're going to be sent into situations that are harmful for us, right? And that's ultimately going to affect our families in one way or another. When we go to calls and we have to tell a patient, nope, I'm sorry, your family member can't come with you. They're not going to be able to be a visitor with you in the hospital. You see their face change. It is a factor in their decision if they want to go to the hospital or not. Because now you're going to be by yourself, going through possibly one of the worst days of your life by yourself. And it's scary for a lot of patients. I can imagine it would be scary for me. I think we need that human touch with our family. We need that family bond. It's a balance we're trying to manage with taking care of yourself mentally and taking care of yourself physically. But I would like the public to know that we are here for them. We're always going to be here for them. It's our job. So EMS as a whole, we have a lot of calls every day, regardless of COVID-19. We're a limited system. There's only 21 ambulances on the island from noon to midnight. And then from midnight to noon, there's only 19. So we are very limited as far as personnel, as resources. Now you're adding these COVID-19 calls on top of it. But if we work together as a whole and as a community, we will be able to recover from this as EMS. Our numbers are going to come down. Our calls are going to come down. We're going to be able to be there more for the community, quicker. We're going to be able to respond faster to these calls. And that's all we are asking of the community is just please take this seriously. Every day we come to work, we're putting possibly our lives at risk, our family lives at risk. The least the community could do is just take it seriously for us. That's all we ask.